Hi, everybody. It's 4 o'clock. That time we come together 4 days a week. And remember that we're going to get through facing some of the most difficult times and some of the largest number of positive cases throughout this pandemic. We're going to make it. The vaccine is right around the corner, it feels. We just got to fight to get there. But if we do that, if we all try, we all do our part and make good decisions, make it through this with us. And that's possible. It is all in our hands. They are the Eagles for today's mask and for working to protect. Yesterday update, we received the weekly White House report. And the White House report issued a warning this week, more dire or maybe more cancer saw it too. The White House said, and this is a quote, even though it's in bullets, the COVID risk to all Americans is at a historic after Memorial Day, but before cases per day. That is nationwide. Now it's more than 180,000 new cases per day. COVID in more than 90,000. This last one is tough. Fatalities have doubled. This is the White House Coronavirus Task Force, the experts, and some of the most sounding an alarm. Right now is the most dangerous time that we have had in this virus. At the time we really need to be coming together and doing the right things is right now, because the ramifications, if we don't, are the most severe of any time in the virus. What they're talking about throughout today's report, but certainly we're seeing across Kentucky, and it is stretching. This is King's Daughter in Ashland, a wonderful hospital working incredibly hard. They are now using one. Again, they are seeing so many different folks that need help. And this hospitalization is dangerous for everybody, not just those that get COVID. Remember, if we fill up all our beds, that person who comes in with a heart attack or with harder for them to be seen, there are fewer people to see and to care about them. And what it does is it increases avoidable death in multiple areas. Now is the time. Is deadly. The steps we are taking here in Kentucky. Remember, we decided to take action. Some other states may not be, but we simply cannot let Kentucky get to the point of no return. So many other places across the country. We are not surrendering. We are fighting back. It's not always going to be popular. It's going to be difficult. Equally, because this virus doesn't spread equally in all places. But it is absolutely necessary to protect those that you love, to protect you. When we see exponential growth, then simply sit back and watch people that we care about be lost to us. So the White House report talked about we're in a very dangerous place due to the current extremely high COVID baseline and limited hospital capacity. A further post-Thanksgiving care with thanks surge. It's my hope that we see a smaller one here than other places, and a lot of steps were necessary to make that happen. Here's something I want you to see. This is Dr. Birx. This is Dr. Fauci. And this is a White House that is of a different party than placed by the governor, should result in a rapid decrease in transmission if compliance. White House saying what we're doing will work because they've seen it elsewhere and they have all the data in the world. They say what we're doing will work. We'll slow down the spread, will slow down this train, will slow down the growth, will protect more people if compliance is high, if people buy in and do their part. So here we got foremost experts in the country, if not the world, saying we got a winning game plan. Question is everybody going to do their part to execute that game plan? We can stop this surge. It's in our hands. And whether we do it is going to be about whether we're willing to continue to fight this virus and to sacrifice for one another. And I'm certainly going to try my very best each and every day. Again, sometimes we feel like this virus is being politicized. Well, this is Donald Trump's White House. And so if there are those in the state and different parties that disagree with me, they're disagreeing with Donald Trump's that Andy Beshear agrees that the plans we're putting into place will work. That means that the public health experts all, and we all do our part. Today's COVID report, I will tell you, we were fortunate to get this in time today. We have so many cases right now that even the databases, the federal and the state cases. So today we have our 6th highest day ever with 3,79 kids 18 and under. We look at kids, we try to talk about their safety. I think there was 400 and something the other day, 800 plus kids in 2 days testing positive for COVID-19. Our total number of cases now, 186,765. Today, we also have the most deaths we've ever had. Yesterday was our previous high. So on back-to-back days, we have had the most 37 additional Kentuckians. And when we get to it, you're going to see that I believe 6 of them are under 60 years old. New cases by county, again, spreading everywhere. Jefferson, 686. Fayette, 219. Kenton, 118. Warren, 103. Madison, 90. Bullitt, 71. Campbell, 69. Marion County, 67. Clay County, 56 cases in Clay County. And they had a lot of cases yesterday, too. McCracken, 55. Oldham, 50. Nelson, 49. 46. Scott, 45. Jessamine, 41. Henderson, 40. Franklin County, 37. Whitley County, 37. Hopkins, 35. Lincoln, 34. Greenup, 32. Pulaski, Greenup, 33. Pulaski, 32. And Barron County, 30. The rest and just about every county is in double digits. Can be found on kycovid19.ky.gov. Again, what that should tell us is it is everywhere. An uncontrolled spread, and at these levels can overwhelm the defenses of any communal setting or gathering. That's why we've asked people not to have private gatherings at their home that exceed 2 families. It's why we have worked to shrink the size of weddings, funerals. And it's why we've had to put other restrictions in place, because that people come together, and especially where they come together and may take off their masks or contact with one another. That's our highest amount ever. And one of our healthcare heroes. Include a 61-year-old man from Allen County. I don't know about you, but I don't believe 61 is old. A 49-year-old male from Boone County. 94-year-old man from Boone County. An 80-year-old woman from Boone County. An 82-year-old man from an 83-year-old man, a 90-year-old woman, a 61-year-old man, and a 48-year-old man, all from Davis County. Turned 43 on Sunday. 48. Again. And it spreads, and that we all need to take the steps to be. Fayette County lost an 86-year-old woman, an 86-year-old man, and a 74-year-old man. Floyd County, a 62-year-old woman. Franklin County, 71-year-old county, an 84-year-old man. Year-old woman. Henderson, a 46-year-old woman. Lost a 96-year-old woman, an 87-year-old man. Individuals, a 74-year-old man and a 67-year-old man. I'm sorry, and also a 90. Jessamine County. Kenton County lost an 8 and an 81-year-old woman. Oak County, a 95-year-old woman, and a 59-year-old woman from Montgomery County. Ohio County, an 85-year-old man. In Trigg County, an 82-year-old man. And in Warren County, a 46. This is not just one where I think this is the most individuals in any report that we have, certainly, but probably in their 60s too. And there is light at the end of the tunnel. These vaccines are right around the corner. Yes, it's losing people. We're losing a record number of people. We gotta, whether it's wake up or recommit, working hard. But we all got to do it working together. What the White House experts say, we can reduce transmission, we can save the people around us, and we can get through this together. All right, when we look at Kentuckians hospitalized in the ICU and on the ventilator, these are all down just a little. That's good. We'll have to see tomorrow to see if it's any trend, because it's down just a hair from yesterday on each. 1,768 Kentuckians currently hospitalized with COVID-19, 427 in the ICU, and 234 on a ventilator. But our positivity rate is the highest, again since May, 9.62%, meaning it's not more testing. It's more people who are getting this virus and more people who are spreading the virus. It's today's memorial for Michael Rodriguez. Can we put Michael's picture up? This is Michael Rodriguez. On Friday, November 20th, COVID took one of our frontline healthcare workers. Michael Rodriguez was a nurse at Norton Audubon Hospital in Louisville. He's only 67. We spoke with Michael's younger brother, Ruben, who said Michael was always on to his next adventure. At 18, Michael purchased a motorcycle, and you could always every moment. An oil rig in California when one team member fell. While others presumed the man gone, Michael jumped in and performed. In that moment, he told his brothers he wanted to help others and moved to Louisville to study nursing. Michael worked at Norton Audubon Hospital for 26 years. His team members said Michael always had a smile, was easygoing, never stressed, and always provided the best care for the patients. He was a friend to everybody who walked through the doors. But on October 8th, Michael began to feel sick. And a couple after several days at home, he was running a serious temperature and couldn't breathe. He was taken to Norton Audubon Hospital and was treated by his coworkers, his friends. It had to have been hard on his coworkers. After some time in the ICU, Michael was transferred to Kindred for rehabilitation, and it seemed like he was moving in the right direction. One day, Reuben received a text from his brother stating he suddenly didn't feel well, and that text turned out to be his last message from his brother. Michael, like so many others, took a sudden turn and passed away a day later from the virus. On November 25th, the day before Thanksgiving, Michael's family and loved ones right before his burial. I think some of us Thanksgiving, and this family was burying Michael the day before. The director of Norton Audubon Hospital, Randy Hamilton, said he's never seen anything like the hospital after Michael's passing. He had made such a positive impact on everyone. Doctors and patients, everyone was devastated by the loss. Michael's brother, he also left behind, and in addition to his brother, he also left behind his sister Cynthia, his fiancee Karen, and his 3 nephews. Today, everybody here, certainly in the governor's office, masks up in honor of Michael, his family, and all his team members and friends who were treating Michael for this virus. I know they are devastated. I know they are mourning this loss. And while mourning this loss, they're still showing up to help other patients. Probably knowing what happened to Michael could happen to them, but also living his example of being there to help those that are in need. To Michael's family, friends, fiance, nephews, we are so sorry about his passing. And we will work to do better each and every day. I hope he serves as inspiration to all of us to be better people, but during this difficult time, to do what it takes to protect everyone. But how about our frontline healthcare workers? Michael deserves, as do our other healthcare workers. So how about we do better in honor of him? Long term, to see new attributable to residents of long-term care. Child care facilities also continuing to see some increases. 24 new facilities with at least 1 positive case, 20 staff members, and 13 new children. With that, we're going to go to Dr. Stack. Effective, if everybody's on board. And then after that, we'll go to Michael Brown, who will give us an update on the COVID outbreaks in our state prisons. Steve?
Thank you, Governor. James, do you have my slides, please? Add to an made this evening. Again, I have to ask everyone. I know there's a lot of frustration and a lot of sacrifice. There's been a lot of hardship. I mean, this is a once in a century pandemic, and it's been hard all around the state, around the country, and that's just undeniable. When we look at the data, I know you can pick and choose which data sets you want to use, which studies you want to use to make points. I think you ultimately have to, at the end of the day, take some confidence in and hope that you have placed your confidence in people who are in these positions, who care about you, who are working with large teams of dedicated experts, trying to review the whole swath of information and make the best informed decisions we can based on experts and good judgment and trying to do the greatest good for the most people we can. I say that because when I present data to you, I am obviously making choices about which ones I share, but they're not random choices. We pick data to share with you that we believe, in the context of all the data we've reviewed, is the material that helps to make more clear how we reach some of these difficult decisions we make and why we think there's benefit to them. And when we draw attention to different data sources or different people reaching similar conclusions, it's because we want you to know, like when the governor shares the White House report, here you have the Trump administration and the Beshear administration, but not agreeing on every single point, but agreeing on the vast majority of points. And so you're getting fairly similar guidance on most of the big topics from two very different administrations. And so, again, it's important when we're looking at the information and we reach these similar conclusions, that sort of helps to net out a little bit, not people just having to make very difficult policy choices to help keep people safe. So the governor has already read to you, and I won't repeat, the White House report this week uses some of the darkest language that they've had in this entire journey of White House reports. The nation is facing an alarming escalation in cases. We have every reason to believe Thanksgiving could make the next weeks and the holidays leading to Christmas, New Year's, and the other holidays associated with the season, major spreading events, and that it could place us in a very difficult situation as we go forward for large numbers of cases, large hospital needs, and overwhelming the healthcare system. It's great that the vaccine is around the corner, but it's still around the corner, and it is going to take well into the first half of next year before we get even just the very beginning, phase 1A and 1B folks vaccinated. And of course, it won't be a linear growth. It's going to start slow as we have small quantities and we build out the systems, and it's going to grow rapidly so that we'll be able to vaccinate a lot more people numerous months into this than we could at the beginning. So now I'm going to go quickly over these slides. So the researchers I had referenced before from University of Louisville. So this is Dr. Karimi and his team at the University of Louisville, also working with members of our staff at the Cabinet for Health and Family Services, have done an analysis. Now they've expanded it. So if you can look to the map on the right there, this analysis now includes Region 3, which includes the Louisville area and a number of counties in the vicinity. It says 11 counties, 15 counties. It includes Region 2, which is the dark gray to the left of that, which includes Owensboro and 11 counties. And it includes the light gray, which is number 4, which is Bowling Green and Warren County, and a total of 10 counties in that area. To put this in perspective, this is a population of almost 2 million people. So this is not quite half of the state, but 2 million people is a substantial chunk. So if we can go to the next slide, please. What their research did was they took the current executive orders that are in place, the ones that had additional restrictions for dining and for bars and for schools and for gatherings, capping it at 25 or less, and gatherings restricted to only a max of 8 people and no more than 2 households, and took those and created scenarios using epidemiology and statistics, and then ran simulations. So you can see in the top right of this graph, they did 300 different simulations for each of these based on an array of data points and assumptions. And then they provided on this integrated slide what the middle point was of all of those simulations. So for Region 2, and again, I'm sorry, I don't have all of these regions memorized, but for Region 2, which includes Owensboro, and on the map here is the dark gray portion over there on the far left. If we have high orders, that we could spare 870 hospitalizations in that time frame. 870. So that's a big deal. They also say that if we go to the next slide, we could prevent 1,583 hospitalizations in Region 3. That includes Louisville and Jefferson County. Now, let me put this in perspective. The typical COVID patient who gets admitted in the Louisville area is in the hospital for just under 7 days. That's when you average them all in. So this is not just 1,600 people in the hospital, it's 1,600 people times an average of 7 days per person. And in the Louisville region, they find that the hospital has just under 4,000 beds. So if we had no compliance with this, it overruns the health system. However, if we have high compliance and you prevent almost 1,600 people from being hospitalized over the next month and a half, you can prevent the health system from becoming overwhelmed. And they say here that even mid-range or high compliance with these new restrictions is projected to prevent enough excess hospitalizations to allow the region's hospitals to operate elective surgeries at normal capacity. This means not just COVID patients have access to care, but every other person who needs medical care that has nothing to do with COVID. And then here, when we look at the final region, which is Region 4, we find that we could prevent 226 hospitalizations. To put that in context, though, because the number looks smaller, there's only 823 beds in Region 4, and that includes Warren County. So if you were to have that many hospitalizations in the hospital for almost 7 days apiece, you'd overrun their hospital systems. And I'm going to do a little cleanup here for the media. I had the wrong number on the first slide. So for Region 2, it's 763 preventable hospitalizations. So 763 for Region 2. I apologize about that. So here's my point is even when our researchers at the University of Louisville analyze and look at the data that's available for the state of Kentucky and do their own modeling, they are finding, like others are in other places, that these measures are likely to reduce substantially the number of people in hospitals. And remember, some of those people go in the ICU, and some of those people are on ventilators. That has long-term debilitating effects for folks. It's not just a quick recovery after you've been on a ventilator for a few days or a week. And then, of course, a subset of them die. And what we're seeing now is the governor tells you that we've had 2 days in a row with our highest mortality. Lost their loved ones. And I'll tell you another sign here, our data systems are really struggling. There are so many electronic labs operating the state system in local health departments and at the state health department and the federal government. They were not built to handle this kind of volume, and the technology just is not as robust as it needed to be, but it has never been asked to do and take on challenges of this magnitude. So folks, every time we choose to not follow simpler, easier guidance, like wear a mask every time you're in public, stay 6 feet away from everyone not inside your house. Every time we choose to disregard that, more people to get infected, more people to be hospitalized, more people to die, more strain on the hospital. So places like King's Daughter have to use a lobby for a treatment area. More steps, higher compliance, and really difficult trade-offs. What needs to be done for the easier, though annoying steps directly drives all these other harmful consequences and leads to where we are today. So I believe to get this under control, get through the next few months with the cold weather, the indoor activity, out to the most vulnerable people, the time or more when we are in public. And if we were to stay 6 feet or more away from each other and not leave the house if we're sick, stay home until we fully recover from our illnesses, I tell you, in 4 weeks, we could get this thing largely shut down. A lot of additional restrictions, but it requires every Kentuckian to just take this seriously and do what needs to be done. Stay home if you're sick. Thank you very much. I appreciate all the hard work many of you have done. I appreciate the sacrifice voluntarily. And I look forward, just like you do, to the day when we can have coronavirus behind us and move on to better times.
All right, next we've got Michael Brown, who is going to provide us an see the amount of cases, the amount of community spread overwhelming our prison systems. So this will show you that it is everywhere. There is not one type of facility that just magically can see this spreading.
Thank you, Governor. Comes to the number of cases exceed 3,000, a little over 3,100 cases. That includes both inmates and staff. By comparison, if you look back to where we were 2 weeks ago on November 16th, that's an overall increase of 700 cases on the inmate side and some 400 cases sadly, we've also had, on the positive side, what we've seen though is our active cases among inmates have actually dropped down to around 300 right now, meaning that the testing and the rapid detection of the virus in the population is enabling to have concern because of the population in the nursing facility. At Lee Adjustment Center, we've had point virtually included the entire population. That number went up over 300 cases in this 2-week period. But again, every time we see that those procedures are shortening the recovery time and hopefully, at least in the general population, reduce the mortality rate. But again, this virus is everyone in our entire community and our goes ahead and complies with the procedures outlined by the CDC. Even with that, until we get the vaccine completely spread, it's going to remain a danger. Thank you, Governor.
All right. So we know where we are at a time where we are seeing more with steps that, whether it's researchers, whether it's the White House, the steps we're taking can work. In fact, the White House believes that they can work very significantly. So we got a winning game plan. We just got to get out there and get it done. We'll open it up for questions.
Thank you, Governor. I'm wondering if you can share your thoughts on the CDC's new guidance on quarantining and saying that it can be shortened to about 7 to 10 days to boost compliance. I'm wondering if that's advice that the state will also, that's a problem that we're seeing in Kentucky with people not complying with that 14-day quarantine.
So we are currently reviewing that new information, and it came out in paper for us to be able to review, I think, late morning or early afternoon. We hope as early as tomorrow we'll be through our analysis, and if it merits it, updating our advice for local health departments. At least what I've seen initially appears to be put on enough data now to where they can tell you the percentage of people after the 10 days, for instance, that would test positive in days 11, 12, 13, and 14. So there's a lot of data that we believe they relied on, and so we are reviewing it. And I hope that we will have based on that as early as tomorrow. I don't think it's anything that information, and so we're going to just make sure what that process was, and then hopefully as early as tomorrow be able to give you our position on it. Next, we have Shelby Lofton from WKYT. Oh, wait, if I can back up, we do see a problem in some instances with people quarantining and the amount of time that they're willing to do it. It is a challenge, and we need people to quarantine when asked to. Do I believe that this could potentially increase compliance with the quarantine? 14 to 10 or 7 days is going to matter. But if it does get just that many more people doing the right thing and it's safe, then good. Shelby Lofton.
Thank you, Governor. Last night, I revoked because it was still open to indoor dining, must close. That coffee shop was still open today, and 2 uniform. Know your reaction.
My understanding is, at least I got an update right before operations. Listen, get the Supreme Court's ruled on it. The court's ruled on it. A law enforcement officer to, can they expect other people that they interact with to follow the rule of law? You know, if somebody doesn't believe in certain laws that we have out there, or drug laws, for instance, I hope those police officers expect them to follow it. And I certainly would like to see a better example. And all the others. This is a in these facilities, types of facilities see the most spread, but we have seen in real life, in real time, in multiple states, and making works. The White House believes they can work really well. Among those 3 regions, there's over 2,000 hospitalizations we can avoid. We only have a hospital for COVID. We have in the hospital. So, you know, we are as a society when it's ignored, even when it's hard, even when it may be devastating, is be.
Thank you very much, Governor. Under your latest executive order, the racetrack-owned casino-like gaming venues are still legally allowed to have hundreds, in some cases thousands, of people, and is limited to 25 people. What is the public health rationale for this difference? And as you said just a few minutes ago, the virus gets in. Are you confident that up to 1,700 people can safely sit under the same roof playing slot machines? Does the tremendous amount of revenue that those machines generate make you reluctant to impose this charitable gaming?
Well, Chris, that sounded like an assumption followed by a judgment followed by a question. But let me try to answer it as entities that have 33% capacity. Their facilities fell in was based solely on a legal interpretation of what type of facility it was. Nothing else had anything to do with it. No revenue, nothing else. It was a legal interpretation of where they fall. Joe Ragusa from Spectrum.
Howdy. So I want to ask about vaccines, and in light of a number that the CDC said was going to be available by the end of December, they talked about possibly 40 million vaccines being available. But as I added the, it's only around a little less than 115,000, which seems like a disproportionate amount against Kentucky. Kentucky maybe not getting as many, a larger share of the vaccine as maybe vaccines coming to Kentucky in December. And how do you read into those numbers? Do you feel like Kentucky is getting its fair share of the vaccine early on?
Well, I think what you're seeing here is something similar to what we saw initially when we were told we were going to get a whole lot more vaccine fairly, that we are getting that amount of how much is out there. And so, my hope is that what they mean is that there are going to be additional shipments near the end of the year that we've been advised. But Joe, than they've told the country about thus far. But my belief is that we're getting. Now we can get out. We have a system that we can lower allocations, and again they can change. Have been the initial allocation of the Pfizer vaccine that we hope we could have, and the Moderna, which the initial allocation there is about twice as much as Pfizer, and that'll come 2 weeks later. Potential numbers, but no direct allocation that we hope can come ramps up. And if there are a third, a whole lot faster. Thing that starts in a trickle, and then for everybody to have the vaccine immediately. The way to do this and to do it well. I have another question here about the focus on vaccinating healthcare providers and healthcare workers, rightfully so. But what's in the works for the vaccine plan for timing of that? Timing for that all depends on the manufacturing schedule, which able to do and how fast, and the number of vaccines. But again, I think we're going to be the number of different types of hopefully along with these other two. What we do as we continue to get vaccines is we continue to sign up more providers, and more different groups from independent pharmacies, government, for more general population vaccination. They have a lot, but a ton of providers signed up, ready to get their shipment and ready to go. So by that point, our expectation is that you will be able to get it at numerous places within your community. Now, early on, it's going to be targeted places that will have it and targeted groups that can get to it. But just like testing right now, and probably more so, we expect a lot of different locations by the time we hit that point. You're also going to see communications from us about the vaccine, about our review of its safety, about what it can mean around December 15th, when we expect the first doses. On what's the current update on the Food and Beverage Fund? 3,168 applications filed, requesting $30.5 million. We're working through it now. Again, we got to ensure that they are real. We got to make sure that there's not fraud. We've already approved at least $3 million, and we'll work through that fast. And then when will I make an announcement about whether or not indoor dining can resume on December 14th? We fully expect that it will be able to. At this point, we have no expectation that we will continue. The current order will have gotten through 2 cycles of this virus, and we anticipate that it will have an effect. We hope it has a major effect, but we believe it will at least have a slowing effect on the virus. Debbie Yetter from the Courier-Journal.
As you all look ahead toward the increase in cases, what is your best understanding of what it means for Kentucky's hospitals and ICU units? And are you aware of any others getting over capacity, such as the King's Daughters you mentioned?
The second part first. What we have seen is different regions taking very serious steps if they're even running a real risk of going over capacity. are important rooms, to have more space for university only group that's out there, and I believe opening a new floor. That if the current exponential growth continues, we will capacity. That's why the steps are necessary, and you hear everybody, White House all the way down, action. It wouldn't be if, it would just be when we went over that capacity and experience the increase in avoidable death once we do. We certainly believe that the step, and we hope never get us to that point, but we do have to continue.
Hi, Governor. This may be mine, who's a college math professor, who's taken a keen interest in the data. It's rising, but the number of non-COVID normal for November. If not, why are the non?
That is definitely a question for Dr.
So I'm still here. I'm trying to process that, Stu. So number of COVID ICU patients, number of non-COVID ICUs decreased. So let me just tell you what I understand. So the number of COVID, I think in the last couple months, has also roughly tripled in the last couple months, and it has roughly quadrupled since about July. So the number of COVID patients in both the hospital regular beds and the ICUs has dramatically increased since the beginning of September. The ICU as a proportion of the number of hospitalized COVID patients is less, though. And I attribute this to the fact that we've worked so hard to try to protect. Some of them have not gotten sick and have not as many as we need, but the Decadron is a steroid, the remdesivir sooner or help the steroid prevent death. For a lot of other things, the position, how to help their lungs function better while they get through this. So I think what you're finding is there are fewer ICU and need a ventilator compared to where we were in March and April when the medical to learn in real time. So I hope that helps. We'll still the total people in the hospital. I hope I made.
Have you, Alex Ebert from Bloomberg is asking a question where I think you can explain vaccines. The question is, how will people are returning to receive their second shot? Their
question, this is just vaccine will be entered into that registry. So we'll have a record. We'll know which vaccine they received. We'll know how many doses or a third doses and not require a. We're going to have reminder systems in place to and have a reminder system cards that we're going to provide for people. And yes, it are just some of the things that make this a very complex under federal and state governments and local governments as well. People to help on this.
and let me add that some of this is built into the system being done by CVS and a natural manner to make that happen and happen on the right days. Other providers that we're going to be working with, Some of them are used to this, whether they gave the hepatitis shot and booster not that many years ago. But Dr. Steck existed for other vaccines in Kentucky before, right?
Oh, yeah. So the Kentucky immunization. Thank you. It is a partnership, and I do yourself, but the federal government built a massive database with they call it CVS and Walgreens will. The nursing homes will tell us their people, their rosters, and then we'll vaccinate them. So we'll have a number of different checks. It will get harder though as we go for every single citizen, but
for it. This is the problem and the challenge that we've wanted for so long. And I know Dr. Stack's going to be working on it, and we're all going to be working hard. All right, we'll go to Karen Czar.
Hi, Governor. Hello, Rachel. This is for you or Dr. Stack. Early on, medical and nursing students stepped up to help when they were needed, those who were near and potentially. Thank you.
We may. We'll look at our National Guard helping in some of our long-term care centers. Our ability to do it and how we do it will also depend on whether or not CARES Act funding extends. We could potentially boost some of our, for who's this. In large part depends on the type of assistance that rightfully so the federal government has been providing us, and we desperately need them to do it beyond December 31st, and we need them to do it soon. I mean, all these systems that we have in place, we got to give people notice at some point about whether or not we're going to have funds anymore, about whether their jobs are going to continue. Take our contact tracers. If we don't have them. We had 4,000 people test positive yesterday. Could you imagine if all you got when you tested positive was an email from the lab? Without our contact tracers, without the funding we provide to the local health departments, nobody calls you to tell you that you're positive. Here's what you need to do. Here's how you need any assistance. Without contact tracers, we can't then call the most fragile folks that have been in touch with that person who tested positive, which is what we're doing right now. Without that, email, not knowing what you should, or your friends. Could you imagine? And maybe not knowing that you need to call people that are close to you, and they potentially suffering for that. Let's not be callous. Let's not remove resources that help people, that check on people. Because if there's no call, if there's no voice on the other end, then people are really alone during this. I don't want to leave our people alone. Whether they like or don't like me, my job is to try to be there for them. And this program is really important for that. Melissa Patrick.
Hi, Governor. So the Washington Post yesterday, health officials and experts said that there's an apparent failure of public health messaging going on if we're going to base it on the Thanksgiving, the traveling that happened in Thanksgiving and people gathering and that sort of thing. And they called for a different approach, one that where people are coming from if there is to be any hope. I have to start again.
Okay.
So basically
okay.
calls for an approach that understands where people are coming from, if there is to be any hope of persuading them to change their behaviors. So some prefer a blunt approach. Basically, if you go see grandma, you might be burying her at Christmas. Others think there's a better way by pulling in local people to tell these stories and their experiences of COVID-19. So what sort of approach are you planning on as we head into the holiday?
all the above. I will try any approach if it'll help people do the right thing and protect one another. And I hope that the media, and it's your job to, but there is certain facts and certain truth and certain danger out there that a back and forth shouldn't prevent media from explaining to people at a time when they really need to hear it. That doesn't mean you quote me. You can quote the expert. You can quote the local person. But as we're in a dangerous season, I think people really need facts, and facts from hospital CEOs, local health department heads, talking to their local newspapers, their regional TV news, and others. And I think, but I will take any advice and any suggestion if it can help us convince folks that have been unwilling to wear a mask and who are still getting together in large groups. I'll consider any advice and any suggestion to try to get them to do the right thing. You sit up at night and you think, if I just said something different or in a different way, would more people do it? And then you try it again a different way. I'll try any of it, and I hope people out there each and every day, and I hope it's good enough. John Boyle from WFPL.
Hi, Governor. So we saw that Indiana is second in the country now. We've been hearing a lot from you and from Dr. Stack about these projections for hospitalizations and that sort of thing. And I wanted to hear, with these border states, Indiana in particular, just because I'm here in Louisville, do you guys take that into account? And does this concern you at all?
I'd have to get more information about the projections that Dr. It concerns us greatly because he can help them. We're not going to turn people away. Just in our hospital capacity, yes, but you don't turn somebody away. My faith tells us that we do. The same rules, not being as aggressive as we are, it frustrates some of our efforts because people who don't want to follow what we can show you will work. We'll simply go across the bridge where you are, or go across the southern border and do things that can spread the virus or get them the virus and bring it back. When we looked at when our Kentucky map, our incident rate map started turning red, it was first so many of the counties on the Tennessee border, then it was the counties on the other side of Evansville, and now, and I think a large part of that is also, Ohio has a 10%, I believe, positivity rate, and so we need others being more aggressive, but I'm going to make does increase the stress and the strain point, but they are people. Let's see. More written question. Wondering if and when Kentucky will be using Apple's exposure notification API for COVID-19 content. The efficacy of mobile apps for their use in contact notification. We've conducted due diligence on 2 specific apps, one of which is the Google app. They may be reviewing different apps. Linda Blackford, given schools couldn't go back even when county rates are high. Right now, what it would take to, especially on January 4th, even in red counties, to be able to conduct some in-person learning. Nobody talks about other adults in that building that are in harm's way when community spread is this high. We hear a lot, children are safe, well, and safe. Not that's true after a post-Thanksgiving of long-term care facilities where we test people 3 times a week. But what we need to make sure is if community transmission is as high as it is, then the teachers, the educators in that building have real options, real on whether they participate virtually or not, and have a that in all these stories, local or nationally, you almost never hear from the people who go in to teach our kids every single day, don't earn nearly enough money, have possible. I just hope that in all of our analysis, we are caring as much about their safety as we are caring about our own. With that, Tom Latek.
Thank you very much, Governor. I've got a 2 slide show teachers in a real high priority area for getting in phase 2 or later. So I'm kind of confused where that stands. And secondly, are private schools that have closed the public schools are?
So the CARES Act money and its availability came directly from the federal government, and it's already been provided. We'd have to look at how exactly the federal government allocated have I believe almost always been first responders and nursing home, long-term care residents and staff around the country. There are those, including myself, that advocate for moving them up, maybe right underneath those 3 areas, because the ability, I mean, if educators who want to get vaccinated, it changes everything. It even changes different everything. And we always knew the importance to our society of in-person class. Man, we certainly understand it on a more visceral level now. So I will tell you, I am in strong favor of getting our educators vaccinated as early as possible. And we're going to be working on the CDC does get together and make these full recommendations. All that they have done right now is the very top allocations. All right, I want to thank everybody. We know what it takes. We have the game plan. We just have to have the will to do it. If you're trying to be the exception, don't want to follow the rules, just remember that 10 years from now, looking back, we want to be a part of the team that took the actions that we're proud of and that saved lives. And yes, I know that there are consequences, devastation. And just remember that we are fighting a worldwide health pandemic that has almost killed 2,000 Kentuckians as we sit here today. And it's going to take a whole lot more if we don't take the steps that we see you here again tomorrow at 4 p.m. Everybody be good to each other. Try to do the right things. Know that you're on a team that cares for one another and that we are not surrendering and accepting fatalities in Kentucky. We're fighting back.